for a sense of identity, I think to myself, well, that's so multi-layered. Currently, it's thinking, what does it mean to be a therapist? What does it mean to be pregnant? What does it mean to be an educator with an NHS background? What do all these layers bring into multiple roles at a time when we're reconfiguring our roles again with the stress and anxiety that's going on?
You have found the Thinking Mind podcast.
Today we're speaking with Dr. Camilla Tooley, who is a psychiatrist by background, but also works as a relationship therapist and works with patients who are expecting. We talk about a number of different things, including how the current situation with COVID-19 has affected her and affected her work, how it affects people who are in relationships and how it affects couples who are expecting. We talk about mindfulness meditation and different ways that it might be helpful to think about the current crisis and not just how to cope with the situation, but the opportunities for growth as well.
You have found the Thinking Mind podcast.
So it's very nice to be here today with Dr. Camilla Tooley. Dr. Tooley, thanks for coming on the podcast.
Oh no, thanks for having me.
It's very nice to be back in the wheelhouse of mental health. We did a podcast with an infectious disease doctor, and that was for a very sort of concrete medical perspective on the evolving situation. So if that's what you guys want to listen to, I would encourage you to go to that episode. But today we're going to talk a little bit more about the mental health aspects of what's been going on and how that relates to pregnancy as well, because that's obviously a huge concern. So maybe Dr. Tooley, if you could talk a bit about your professional experience, your sort of journey in your career until now.
Yeah, no, so I guess quite a varied background. Obviously trained initially in medicine as a doctor down in Brighton, quite a multicultural place. I did a psychology degree there as well. You can do a year during that time. And I set up the Psychiatry Society in my uni. I was always aiming towards mental health and well-being, very, very interested in that. And then I had my foundation years, so junior doctor years. Travelled over to New Zealand as part of that, and then from there I came back over to England, started as a psychiatry trainee with South London and Maudsley, and then I was very interested in medical education and relationship work as well, on a background of some, I suppose, personal experiences too. And I decided to take some out of programme time, so I did a diploma in medical education and relationship counselling. And actually, I found that was, I suppose, my niche. I absolutely loved everything that I was doing. And I actually exited from psychiatry and now work half of my time as a medical educator for more stimulation and the other half of my time as a relationship counsellor for Relate, which is a charity organisation looking after couples. I suppose, in my interest professionally into this regarding perinatal work, I run a number of the courses for more stimulation on perinatal mental health. And I guess my background into, I suppose, having clinical experience that way is that I've been working this year in voluntary capacity for a perinatal psychotherapy team. And I've also had a year infant observation at Tavistock where I was looking into things that way. So that's my kind of professional background, I guess.
Mm-hmm. I've always been fascinated by relationship counselling and how therapy can help people communicate better with each other. What drew you to it personally? So
I guess actually looking at mental health and really wanting to help with mental health and well-being and entering into psychiatry and I had a number of frustrations through that process, and I guess coming into it I thought to myself, well, the social relationships that we have are the fabric that holds our well-being actually as the first fundamental. And if you actually look, there's a Holmes-Rafe scale of most stressful life experiences. Pretty much everything relationship orientated is at the top of that. So many experiences that are most stressful in life as humans that are around our relationships. So I think for a long time I was very mindful of that and thoughtful on what does that mean. From a personal perspective, my family, my mum had challenges with mental health herself. I very much believe that the 40-year marriage that she has with my dad is the thing that pulled her through those experiences. And I guess also I've had challenging relationships. We go into these things as therapists because we've had difficult experiences ourselves as well. And I hope that adds to levels of understanding, as much as very much recognizing every person's experience is unique to themselves. But I've had, difficult challenges as well within relationships, and that's really made me very thoughtful of wanting to learn and understand more around that, and really want to help others. I'm now very happily married and, love my partner to bits. But, I'm sure at the same time, with all the skills and training you still have your conflict-ridden days where I joke with my partner, just because I'm trained in this stuff doesn't mean that I'm not going to have a row with you. And that's quite healthy in itself.
Yeah, of course. So it sounds like, I think a lot of people are like you in that they go into psychiatry with this desire to increase people's well-being. And I think psychiatry has a tremendous opportunity to be holistic. But as you say, a lot of people go into it and feel frustrated, I think, for lots of different reasons. One of them might be the sort of limited scope of the medical model. And others might be the fact that we don't actually necessarily go into the more social and psychological aspects, perhaps, as much as we should. But it sounds like you found your niche where your interest and skill set kind of aligned, and where you could be of maximal benefit to people. Is that right?
Yeah, I guess for all of the above reasons, there's frustrations that might be held, and I absolutely agree with you that it's also a specialty that offers the ability to holistically think around things and help patients. For me myself, I guess my real passion into relationships came out through that training, and it was something that I platformed into, and I love my work, and I guess it fits my model also for me, that I feel I'm getting in a little bit earlier to influence things before they start off. And certainly within psychiatry training, it was for me always an interest in child-based work, the earlier focus, the preventative focus that one might have around things as well.
Mm-hmm. What are if you had to describe problems that you see really, really commonly in relationships that you think, gosh, if people knew these 1, 2, and 3 things, it would have a huge amount of benefit, what would they be?
So I guess one of the things would be not necessarily saying that it's 1, 2, or 3 things. It would be probably saying, with a really light touch, everyone's relationship is unique, and not to come into believing that you have an understanding of what goes on behind closed doors for a couple. Within that, there's very much the fundamentals of communication being a bedrock to all relationships, and a focus on which ways we care and cope, and how a couple can support each other through that. And I guess lots of the work will initially start on focusing on building up communication skills so a couple can explore and understand one another more, so that they don't build on assumptions of knowing the other person's inner world. And then into that, there's also looking at family work, looking at the past experiences that people may have had that may frame how they look at their relationships in the here and now. Knowing that, I guess, the dynamics that we have today are representative of dynamics that we may have had in our past relationships, and really being respectful and understanding of that as well, getting that awareness helps. So I guess it's understanding, and it's building skills, but it's unique positions for all, and there's very varied experiences that come into the counselling room.
Yeah, so obviously treating every relationship as an individual thing is very important, and also building up those communication skills and really being able to recognize that there's often a gap between what you think the other person is thinking, feeling, and experiencing, and what they are actually thinking, feeling, and experiencing, and then building skills that help to bridge that gap.
It's really thinking through layers. I'd love to say that it was one or two or three things. And I think that's what a lot of couples may enter into the room thinking, right, give us one session, give us the three things we need, and we'll exit the room, and that will be great. And I suppose it's opening to the fact that there may be multiple layers to how a couple interact with one another. But the bedrock is the communication first and foremost.
Mm-hmm. Yes, and the other thing you mentioned, which I'd really love to expand on, is the idea that our past experiences and events can really influence how we interact in the present with other people, with people in our lives now. And I wonder if you could talk a little bit more about that.
Well, I mean, I suppose that's so varied as well when we're kind of looking at it. But I mean, there's basic models with thinking around attachment theory, thinking around how we cope in difficult responses in our relationships, and you know, and that, I don't want to put terminology on that, I suppose, in that way, but very much to focus on the fact that the experiences we've had before may mean that we have a certain way of looking at the communication and the interactions and the interplay between us in couples in the current time. So I guess if one has had, as an example, a parent where one felt that one wasn't heard or didn't have the space to be heard, you know, an example, you've noticed your dad would tend to look at the newspaper and not look up from the newspaper, you know, a very trivial example. It may feel that there's an impression with your partner that you'll equally be thinking, well, will they hear me? Will they be present? And perhaps it may even have an effect on what you even share, because you imagine that the other person won't be present, won't be receptive to hear the concerns or worries that you have. But it's multi-layered and it's multi-relational as well. We think about parents first, but it's the whole impact of a wider family, and it can be intergenerational. So going up to your grandparents, strains as well. So in an example there, if you knew that or experienced that your grandparents and your parents had difficulties between them, there might be a concern in entering into a couple relationship of, well, what might that mean about, the wider family, how we integrate? There may be underlying concerns, worries, anxieties about what that mix will look like. I view these all in positive frames, though. It's gaining that understanding means that we enter into conversations in different ways, and we can be really thoughtful of what both of our experiences, because of course it's both people in the couple, and both having those different variety of experience, what that brings to the mix.
Yeah, so it's not a question of trying to dig up all of these negative things from the past, or how people have hurt you or traumatized you or whatever it is, but rather it's simply about formulating a roadmap for your own psyche, where you simply build a working sort of formulation for how people in your life have affected you, how you've affected them, how events have affected you, and therefore what psychological states you bring to your current relationships as a result, and how you might perceive people around you as a result.
I think a couple having awareness of the difficult experiences for the other means that they'll be more tuned also to think about themes, particular triggers, particular time periods, particular instances which might be difficult for their partner, and that can be really helpful. But it is very much saying that not looking at these things as impacting us in all time moving forward, but actually looking and saying, well, that's one way that things may have felt vulnerable before. What might that mean now? And what other ways can one frame how one looks into things at the current time? And also the strengths. There can be great value and appreciation and empathy building from having had these difficult experiences, which again, I think and I hope is some of the formation of people going into therapy when they have had difficult experiences themselves. It builds the empathy and understanding.
Of course. I think we could probably do a whole podcast about just this topic, but talking about the current situation with COVID and obviously this huge societal impact that it's had, how has your experience through this, how has it impacted sort of your life and your work?
So, I mean, I guess on relationship perspectives, there's a huge effect of isolation at the moment, and we know what we can think about that of social distancing. But I guess that goes again into a wider way and thinking about, I suppose, in this podcast about pregnancy as well and what that represents. And I'm currently pregnant as well, which was the personal reason for doing this too. A multitude of effects. I think when I think about anxiety, I think around core anxieties we have as humans, which is around illness. We have the concern around illness and threats that may be coming that way, around our sense of self, our identity, our loss of autonomy, and what that might mean for us as well. And I guess it's thinking within things around how we can support around those kind of core concerns that we might have. And rejection and isolation is another core concern too. So if you think that we've got those core fears all simultaneously going on in social isolation, it's trying to work around those things. So I guess I'm constantly thinking, how can I limit the amount personally of time I spend focusing on COVID, that I have like I would with any anxiety, anything that causes anxiety, think I'll have a set period of time for myself to look into this, to keep updated, but limit it for myself during the day so that concern around illness doesn't overwhelm me. For a sense of identity, I think to myself, well, that's so multi-layered currently. It's thinking, what does it mean to be a therapist? What does it mean to be pregnant? What does it mean to be an educator with an NHS background? What do all these layers bring into multiple roles at a time when we're reconfiguring our roles again with the stress and anxiety that's going on? And with the isolation, it's thinking, yes, well, what would that mean for me? What does that mean for my clients and their unique ways of how things are impacting on them, and thinking about, again, setting those thoughts around the different anxieties and how they're forming them as a couple. And on the perinatal work that I'm doing, I'm seeing that fitting in all different ways as well. Every mum is thinking about things themselves in very different ways. There's some mums which are reveling in a little, in some, or mums to be reveling in some extra time with their partner, and the fact that that's enabling some time to be reflective before the birth. There's other couples which are entering into strain of how to, as I'm seeing in my couple work itself across the board, how to manage the juggles of doing multiple things in a smaller environment where you're having to kind of factor what work-life balance looks all in the same place with your partner. And I guess for just understanding from relationship clients, when we have referrals, we tend to have referrals that peak around Christmas time and around summer holidays. And this always makes a mark for me, that I think with clients before Christmas and before summer holidays, what might be the stresses that will be coming up in these times, because we have heightened expectations and we have heightened difficulties and stresses when we're in enclosed spaces for periods of time. And I guess this is a similar theme when we're thinking of we're being under isolation for a period of time. How do we have our own space? How do we work in the time that we have together? And how do we manage the heightened anxiety that's present?
Yeah, it's really interesting. I think the situation, firstly, I think it's important to recognize that the uncertainty and all those fears you described are, of course, ever present in our lives. But a situation like COVID really brings all of them out, and it really stops us from being able to sweep our fears under the carpet as we might normally do. And all of a sudden, we're facing things that you mentioned, like illness and mortality, much more directly. At the same time, as you mentioned, because we're now living these very stripped back lives, we're staying at home more, we can't distract ourselves as much. People are really being forced to reckon with their lives in a way that they can't normally, and really examine what it is that brings them fulfillment and what doesn't, and what brings them stress and what doesn't. So it really amplifies all of those sort of potential causes of anxieties and worries, but at the same time is a tremendous opportunity for an increased level of consciousness and growth as well. How have you been coping with the situation yourself? You mentioned that limiting news, of course, is very important. You want to stay updated, but you don't want to, like, there's a limit to how much new information is going to come out on a daily basis. And I think past a certain point, you're just going to be digging yourself into more sort of rumination. So of course that makes sense. How else have you been coping with the situation?
I guess with anxiety, you equally think what's in my locus of control and what's outside my locus of control. So when I'm thinking of anxiety, I go into a little, and we try and reframe this when I'm thinking with couples, when I'm thinking with pregnant mums. What can I manage now, and can I shift, and what is it just outside of my ability to make a change or a difference in this, and I think that's a very grounding thing of thinking, okay, well, I can come into the day and do something today to try and structure in some routine that I've perhaps not got as much of because of the fact that my work-life balance could easily overflow in the same space. I can make sure I still have a walk today that's going to get me a bit of exercise, and that's important for my well-being, for my mental well-being, for my physical health. And I'll make sure I'll keep a distance, and I'll cross over the road if anyone comes close. I'll keep probably even over that 2-meter distance, but I can make sure I get a little bit of that physical time in for myself. I'll help in the ways that I can. So I'm certainly my natural ways of coping, and I think this is something I often ask in the therapy room, is what would be your natural ways of managing or thinking around situations in other times. Maybe not using the word coping, because sometimes coping can be loaded in itself as well, but thinking about the natural ways of managing through things for oneself. And I suppose I am somebody who does, and I do a lot. I can naturally become a little bit hypermanic when I encounter some worry, and I guess I try and balance that with what will be again conducive. What things can I do, and at what points do I need to put the boundaries up and try and let go of things.
So it's very stoic in that sense, and I don't mean stoic in the modern usage of the term, meaning sort of neutral, but actual classical Greek Stoicism, and the Stoics were actually thinking of doing an audio essay about Stoicism on the podcast because it's so relevant. But classical Stoicism is all about trying to look at your immediate environment in as objective a way as possible, and really focusing on what is it that I have any influence over changing, or what don't I, and then choosing to focus your mental energies on the things which are changeable, which is also reflected in the serenity prayer that people might be familiar with. It's commonly used in AA. Lord, grant me the wisdom to change the things I can, but to have to accept the things I can't, and the wisdom to know the difference.
I've actually brought that serenity prayer sometimes into thinking around things with people. I think it can be really helpful. So that does really strike a chord. Yeah,
it really gives you that clarity of thought that it's so easy to slip into modes of thinking where you can spend hours. I think I'm not sure how much people outside of mental health realize this until you actually look at it and see yourself and see people doing this. You can spend hours ruminating about things that are going to have no meaningful difference in how you live. And it's almost the default of the brain to go into that mode, it seems like. And it's really an active process to sort of bring yourself out of it. And that's why, of course, any introspective process, whether it's therapy or journaling or meditation, can be so helpful for creating those periods of clarity.
I think that the two things that I've consistently seen reading through well-being literature is having reflective space being important, and having the boundaries being important. And I do bring myself back to those cores again and think, okay, what spaces can you have to connect yourselves, to think around and think through things, and what points do you need the let go to kind of separate across? What can you let go of?
Yeah, the letting go is something that isn't emphasized at all in modern society, really. We emphasize control a lot. How can we control our situation? How can we manipulate it to suit our needs, which of course is very useful. But there's no emphasis, sort of implicit or explicit, on how can we let go of things which are no longer useful. And letting go isn't, I think most people think of letting go as like a personality type, like some people can just let go and they're fine with it, but letting go is actually a set of skills that can very much be learned.
One thing I've often thought of is the brain and how the brain develops, and of course it goes through the lovely period of pruning, through the synaptic pruning of cutting away and remodeling the brain, and that's part of the way that we develop the brain in such an ornate way, and that's. Sometimes I think that's exactly what we also need in life. There's something for adding things and there's something for deciding what we subtract.
Yes, like destruction can be just as useful as creation.
Absolutely.
Like, for example, if you think about how a statue is made, it starts from a solid block, which you then go inwards. You remove stone so that then the statue emerges from within the block rather than adding more material to make the statue.
Yeah.
Is there any particular place people can go to for information about COVID and how it relates to pregnancy so that people can get more sort of facts and be more aware of what they need to know at this time?
Yeah, I think there's obviously a whole range of information and it's evolving constantly. So again, a caution that when people are reading something, it is really important that perhaps we stick to like a couple of designated sources so that doesn't pique concerns going through this period. I guess the Royal College of Obstetrics and Gynecologists, they have been writing and updating around thinking about pregnancy during COVID. And I know that the Royal College of Psychiatrists is going to potentially come forward with some guidelines, policy thoughts on things as well, but they will be changing with more evidence as it comes forward. But those would be two sources. And then there's the government obviously keeping on what the government is just putting across, and there's keeping in touch with the NHS. But I would say it's still limiting the amounts of time one puts into looking at these things day to day. And it's knowing that there will be changes with more information as it comes forward.
Mm-hmm. So limiting the amount of time and respectable sources. So I think if anyone wants information from the Royal College of Obstetrics or the Royal College of Psychiatrists, you need only Google them and then
exactly.
You'll find their latest guidelines. But like Dr. Tooley said, it's very crucial to be aware that we're very much in the beginning stages of this, and that it will take probably a period of years to fully understand and fully get all of the relevant information. So obviously new stuff's coming out all the time, but just to be aware that this is a situation that's changing on a day-by-day basis.
Yeah, I guess all people look at the moment is thinking about what was known previously, and I think some of that obviously still applies, of thinking about pregnant women and how we would have flu. We have our flu vaccines, we have our whooping cough vaccines. We're trying to be mindful of the fact that infection can have an increased impact for women, and it's trying to protect yourself still in all the ways you would have done previously, thinking around those concerns. And obviously it's keeping ourselves isolated in that context of thinking about things too. But I think that knowing the overall risks to mum, to baby, what preferences might look like later into pregnancies, and what needs and resources there are, that's going to be something that does shift as we continue into the weeks and months to come.
Mm-hmm. Have you found that in the current situation, in your patients who are pregnant, that there are distinct new problems which have emerged because of what's been going on, or is it merely an amplification of problems which are more common generally, and now they're just heightened as a result?
I think my systemic training elements of me, I never like this or this, or it's like this and this. I guess again both will be coming across. So before going into having a pandemic, it was already one of the most it can be one of the most challenging transitions to go into and go through. we're then put into the uncertainties in addition to pregnancy of what a pandemic represents. And yes, it is multi-layered, and there'll be new, unique things that come forward for that for each woman, and there'll be similar stresses that are amplified, that are added into a what will I be now as a mum? What might it look like now for the health of baby? What does it now look like for how I maintain doing different things? And now I'm working remotely as well, or now I've got an additional concern of the health of my wider family and partner in addition to baby. All these ways which there's more layers added into the picture.
Mm-hmm. And what are the common mental health problems that typically emerge during the perinatal period?
So I guess everything can come forward. So I think first and foremost, it is thinking about preventative, proactive stresses. If you are thinking about all the transitions you go through, physical change in every way. So obviously every trimester has its own physical symptoms, but they don't just work like that. They cross across all trimesters. And of course, morning sickness isn't just in the mornings. So you've got every interplay of physical concern that can have impact. And it's important to think around that first. And then you've got every level of change that can take place for an individual, with thinking around what that looks for the home life versus a professional life, what that means for finances and concerns that there might be coming forward there, going across to maternity leave, what it means for relationship dynamics. And it can be a risk period again for relationships during this time. There can be heightened concerns around partners feeling jealous over upcoming maybe sex changes, during this time. There can unfortunately be risks of domestic violence during pregnancy as well. So every biopsychosocial factor can change across the perinatal period, across being pregnant. Within that, and within well-being being shifted, and it being that important acknowledgement first, because there is no normal, and we don't want to kind of put an experience that is otherwise really stressful and say, well, let's medicalise and think about going straight across to mental health. So that's how I come to that first. But within that, I suppose depression rates will be around 10-15%, obsessive compulsive disorder 2.5 to 9%, and psychosis, it can vary from 1 to 2 people in 1,000 to up to 50% risk of that if you have had psychosis before, or you have up to 60% if you have psychosis and a family history of. So you can see that the rates there are high. It needs to be taken at absolutely at the same time in context of the massive transitions and shifts and stresses in every platform that can come forward for a pregnant woman and for their family.
Yeah, so of course every transition period is, I suppose, a period of vulnerability. Yet at the same time, as we're learning now with coronavirus, that vulnerability is typically paired with opportunity for a new perspective. Mm-hmm. So what are the perspective shifts you often find working with pregnant women?
Yeah, I think that's really helpful to put that forward as well. So it can be a time of new appreciations, of valuing it. It's almost as, I suppose, any transition is a new stage to actually go through how one might have looked at things before. There's lots of studies that might mean that one becomes more introspective during the time of pregnancy and more reflective in that way. One might go back almost to a period earlier in one's life and kind of be reframing through. So it's a new opportunity to, I suppose, review and reflect and shift and change, and families can come close with one another as well. It can be bonding experiences. It can bring further intimacy and understanding and empathy through the difficulty. So all of those things, those are the hopes of those shifts, and noticing the small things, the things that are, perhaps not recognised before in the small moments that one has with one's baby, what one has with one's family. Those things, they are shifts and they are appreciations and they are new opportunities that can come through the process as well. It has that balance of knowing that things can be difficult, and also knowing that there can also be, big appreciation shifts in life at that time. It's knowing both.
Mm-hmm. Yes. And of course, you're in a particularly interesting situation in that you're working with your pregnant patients and now for the first time are pregnant yourself. Mm-hmm. So how has that influenced your work?
Yeah, so I guess I've been really mindfully looking up on lots of previous reading and everything else around this area, and I've talked to my supervisors around it, this a lot, thinking about it. So I was very reflective of knowing that it will have an impact beforehand. I guess from looking through things, there's a lot that, as I say, with that being an introspective period, one can focus on the pregnancy, and that can have impacts in different ways. One can have heightened insight and awareness, and one can also potentially not be as open to taking understandings in as well. There's some things that come up around that particular elements in therapy one may shy away from, understandably so, for it being difficult to hear certain experiences. I guess on a personal perspective, I very much remember around my 12-week scan, I had a very strange situation that I had 3 separate couples that were describing to me having lost babies early in their pregnancy and have identified it at the 12-week scan. And I had this the week before my 12-week scan, and I thought this is unbelievable to have had all of these separate couples coming forward to me at this time talking about this experience. And there is a lot there in literature thinking about transference, counter-transference, the feelings that we may have to patients, the feeling that patients may have towards us, that these things can be heightened, around the time of seeing someone's pregnant. But you very much wonder when you're not showing and you're in the early stages how people would necessarily have any concept of that. But your sensitivity, definitely, for that experience was really difficult. It was really difficult hearing, and I really hope I was open and went into those experiences as clients needed me to do at that time, as was helpful for them. But it's with all relationships, you think how, there's this model of supervision, 7 eyes of supervision, where am I, where is the client, where is their past experience, where are my past experiences, what is the wider context we're in, all of these kinds of factors, and I guess there are layers added when you're going through the pregnancy yourself. There's that a change to the dynamic that you have with the clients if you're hearing those stories coming forwards to you. It adds an increased empathy that will come out. It also adds a difficulty of wanting to perhaps stand back from hearing certain things. And then there's the level, I suppose, on self-disclosure, because that's a big thing within therapy anyway, of being thoughtful around when might you say or not say something personal about yourself. You can't hide the fact that you're sitting in a therapy chair that you're changing shape and someone can see that. So how do you manage that when you're talking about it? How do you manage thinking about that? Being mindful of those clients that I described before. What may they be thinking? What might that be bringing into the space? So I guess personally, I can recall some points that it has really been difficult. It has really been making me very thoughtful. I've been very thoughtful, thinking on what might this mean for the person in front of me during this time too, seeing that might be all kinds of fantasies and ideas coming up for the individuals. But yeah, it's lots and lots of different ways that it can have an effect, and I guess a lot of hope going to the other side that you said, Alex, as well. Like I guess hope's coming forward too, appreciations, values, looking in that introspection to a new stages coming up for myself, and that being an exciting time at the same time as feeling anxiety provoking and having natural effect that way.
Yes, I think one of the perennial problems in the therapeutic relationship is the balance between empathy and sensitivity, and then on the other hand being vulnerable to the very difficult material that can often come up in therapy for any therapist, let alone someone who is in a state of transition as you are, and therefore that sensitivity and empathy is heightened. But then again, so is this vulnerability to dealing with material which isn't always the easiest. At the same time, I imagine it must be quite empowering for you that for the first time when dealing with your pregnant clients, you can have an attitude of been there, done that, of I have now experienced this, and that I would imagine would really make you more steadfast and confident in dealing with those kinds of patients. Is that right?
I guess coming into, again, the going through an experience yourself brings more insights through having an experience. And I'm so mindful through all the different experiences I've had, how unique that experience again may be for the person, the other family. And I suppose a core with therapy, I always think is trying to utilize that empathy at the same time as not putting your narrative, your script on the other person. So I will look at kind of points that I've had where I've, the less kind of glamorous moments that people don't talk through, where you throw up in your mouth on a tube train as you travel into work, and you're told you're beautifully tired by a work colleague, and they attribute that to the fact that you manage 15 different roles anyway, and you think, well, you don't know that I'm also 10 weeks pregnant. But at the same time, it's absolutely puts you into the perspective of, well, what unique experiences there must be for others going through this, and just being very sensitive to not name that what you're going through is what that the other person is definitely going through, because you don't know. And I think the experience makes you more aware of more areas that you didn't understand or didn't know before. I guess that gives an understanding, but it doesn't ever give you the full picture.
Yes, and I think that's quite a wise approach with increasing knowledge and experience, to actually be more doubtful and less certain, and maybe have an increasing comfort with uncertainty, rather than to make claims that you have some sort of ultimate knowledge about an experience just because you've had a version of it.
Absolutely. With more experience, I become more aware that I have no experience, and I jest around it. But I think that is a really important thing for us all to be careful around.
What are some of the problems that relationships frequently run into when couples are expecting, in your experience?
Yeah, so I guess I'm viewing this in two hats in another way now, as you say, but again, not putting my experience onto it. I think for what I've seen, it's I guess a core thing I would put is not to focus purely just on mum, because partners present too in this, they're going through a lot of change themselves. There's something around a jesting around, say, a dad going through the same symptoms as mum. And with more evidence that emerges, they actually have found that the hormones for men can vary around the time that a woman's pregnant as well. And I found that fascinating, that their oxytocin levels go up just due prior to the birth. And so how do we know that a partner isn't experiencing some of those physical symptoms at the same time as experiencing the massive shifts that are coming forward? Of course they would be. And I guess it's a time of ultimate change. So if you're looking at core kind of things that may be coming forward in the first trimester, there might be a lot of thoughts on what's it going to be coming up to the first scan. What does it mean about us not saying or saying to other people around this? What might it bring up for other people in that experience? What does it mean around looking at, into the second trimester, around what will the scan mean then? Is the baby going to be healthy then? What does it look like about us being parents? What new roles might we have? What kind of mum am I going to be? What kind of dad might I be? What does it mean to kind of go into those transition periods? What does it look like as you're coming closer, thinking about the birth and concerns around what the birth might look like? So there's all of these potential concerns that may be coming forward, and unique ways of, I suppose, readjusting to those elements as going through. So, what it means around the fact that, if you can't pick up more things and lift, and your partner is going to be taking on more household bits in the house, how do both of you feel around that shift? What is your traditional, have you got traditional role systems? What kind of dynamics might it be shifting for you? It brings up a lot of reflection on one's own parents, on actually what their experience may have been like, what was their journey. Reflections can come up in that way. What's that mean about the parent I may be compared to the parent I observed, compared to the family of the partner that I may have, compared to, if I'm more isolated, if I don't have those wider connections for myself, what is the future going to look like? Because it could merge in so many different ways. And then I guess is just thinking, well, if going later into of having having a child, there's the natural shifts then of, baby blues are going to come forward because hormones will shift for women, and that's before we even think around a depression or anything else. There's sleep deprivation. There's I think a core thought on actually with mental health too is really delineating between physical symptoms and emotions that come up, because it's very difficult to cover in this period what does the physical changes of the pregnancy and after just represent, aside from these might be changes that would otherwise represent mental health. So there's lots of changes and transitions and stresses and factors that can come forward, and I guess couples in those situations may respond in lots and lots of different ways to that, of trying to trying to perhaps finding it hard to talk about it, to acknowledge it. Family, everyone has an opinion during pregnancy. I think that's a really big factor that comes in, and everyone has different information. And I think this is one of the real cautions I have currently in a pandemic of what it looks like anyway for pregnant women and for women after birth. The number of women I've seen where they say, one health visitor told me this and the GP told me that, and then my mum had this perspective, and I was thinking when I read this article here or that book there that perhaps I should do this, and then two people in my NCT group, they said that this was a better way of managing it. And how do you contain all of that different information coming forward to you and expectations coming across? And I think a big thing that can bubble up for people is, am I good enough? What is my role now? Am I an imposter in this situation of being a mum? Imposter syndrome can come up fourfold of, I'm taking on this new role. What does it mean now in this position for me? And it's accepting that all the other experiences and roles are brought into becoming a mum, and it's at the same place, a completely new stage and step that's being brought up.
Yes, I think the feeling of I'm not good enough is something that it's a real indicator of where you're vulnerable. And I think in times of stress really push on those vulnerable aspects of anyone. And I think that I'm not good enough feeling is a really common sort of red flag, that these are bits where you don't feel so secure for whatever reason, be it a point of transition like pregnancy or for any other reason. I imagine, infection and this pandemic, it's so primal. And I wonder how many, obviously women are feeling very anxious, understandably. I wonder how many men in expecting couples are feeling very helpless and very, very scared that they're not going to be able to adequately fulfill that protector role for their partner. Is that something that you've encountered?
I think it can be in a variety of ways where a partner feels how that, as I say, how it changes, relationships change in so many ways across this time of what it means around intimacy changing, sex, the relationship that way changing, what it means about role sets changing. There's a lot of change in relationships that come up, and then if you add into that a pandemic, it puts that added layer of, well, what does it mean now? How am I as a partner identifying myself? Am I an imposter as well? Am I a good enough partner to try and support? And I guess, yes, absolutely, that can come forward full force, because it's realignment. My partner, he's going through his own transitions at the moment with what it looks like for work, for finances, for stresses there. So the worry on how to support is multifold. It's thinking on, what does it look like for me with my partner, making sure that I'm keeping social distance, that I wouldn't be the person that would come back and potentially pass this across to her. What would that mean? That's one layer. What does it mean that we're going to financially be able to ride through this as well? Economically, how can I support? There are lots of different ways that there may be worries for couples on what the support's going to look like. And again, I suppose with the core of this, it really comes across to that communication, to discuss with one another how you both may be feeling vulnerable, what the needs are looking like for both of you, and how to support one another through the time.
Mm-hmm. So in terms of what people can do, we discussed being careful with intake of news, taking enough to be informed, but not so much to worry you unnecessarily. And we talked about exercise, we talked about open, vulnerable communication. I've found mindfulness meditation to be quite useful as a coping strategy. Do you have much experience with that?
So I started a yoga training at one point as well. So I've lots of different things. Mindfulness, I think, is very, very helpful to have that space. Again, it offers another time to be present, to ground oneself, to give oneself a little bit of space that way. And obviously that's another resource that one can go through now with Headspace app as something that's available as a practical thing to kind of connect into. But yes, I guess all of the things that we think on before the pandemic are very, very helpful for well-being. So NHS 5 ways of well-being, connecting with others, learning from others, taking notice, which I suppose comes into mindfulness, the focus on exercise that you would have. Trying to think of the last one. Giving out to others. So, I guess coming back to the things that we would have looked at before to help with well-being, it's really, really important that we keep a focus that way during this time on what we would have had before, that we know before, and also to look after one's physical, mental health in the way that one would have before. So still making sure that we keep the same health checks on for ourselves, and I guess for mental well-being, for mental health, being aware and noticing early to get support early from other people.
Talking more about mindfulness, I think the apps you mentioned, like Headspace, Calm, are very effective. We, in the past few weeks, put a couple of free meditations on our podcast, actually a 10-minute session and a 20-minute session for anyone that wants to check that out. How would you explain mindfulness to a skeptic? Because I'm not a skeptic, obviously, but how would you explain to someone who doesn't have any experience with this how, sitting alone with your breath can be helpful psychologically?
Oh God, that's a good question. I guess people can have the common misconception of doing mindfulness wrong, of thoughts coming forwards during mindfulness, and I guess it's saying what it's not, that's perfectly natural for thoughts to be coming up as you're going into practice. But having, I suppose, that space to pause and take notice, and that can be very, very helpful. I suppose it can, in a mindful, there's lots of different practices. In a mindful moment, if you imagine that you've just had something that you've experienced as stressful, you could see that it would be immediately removing one's fight-flight mechanisms and actually bringing oneself back into one's body at the time. I've used mindfulness before, if we've actually been perhaps just describing something that's brought up a lot of emotion in the room. Sometimes it's to actually just reground somebody into the therapeutic space of focusing just on the breath and where they're positioned in the room, and those kinds of things being immediately helpful. In a longer standing way from the research that I suppose that is coming out, it can have such a myriad of different effects for helping well-being, not only in decreasing stress and anxiety through that focus, and there's a lot of research coming out there, but even in helping memory and learning. So I suppose that there's known outcomes that are beneficial of having this practice. There's known application of it being helpful in an immediate way. And I guess, though, my one point would be just to try it, because I suppose it's the experience of it which makes, and that's probably why any mindfulness training that people go into say that people should try to have mindfulness regularly for like over a year or something, because it is the experience of itself that actually shows you the benefits.
I think what you mentioned at the start is really important, that I think a lot of people try mindfulness meditation, they find thoughts coming up, and then their immediate response is, I'm having these thoughts, therefore I'm failing at meditation. But in reality, the real victory with meditation is to simply notice again and again how easily your mind can be distracted and derailed by thoughts, and to get better and better at not being distracted. And that's really, being lost in thought is somewhat akin to being in a dream and not knowing that you're dreaming. And so your ability to continually recognize that and wake yourself up, as it were, is crucial. And then, of course, what you mentioned about disabling that fight or flight is so important, because often we're in that fight or flight mode, aren't we? If we're in a stressful work situation or a stressful situation with a partner, and actually being in that mode and the behaviors that's going to lead to, like very reactive behavior, like saying something that you're later going to regret or making impulsive decisions, is often not the right thing to do at that time. So having a tool that can disable that fight or flight response and lead to a calmer, more grounded response, it's shocking how incrementally over time that can improve your quality of life.
Yeah, no, I agree with everything you just said, Alex.
Dr. Tooley, I've taken up a lot of your time, but is there anything else you'd like to make people aware of, or any other advice that you have for couples, expecting couples, or just anyone that's feeling unusually anxious at this time?
From More Determination, we're doing a couple of videos around well-being. So I'm running a pregnancy and well-being video, and also my team's running well-being at home. So those are a couple of things that come up with things there. There's, I suppose, signposting just to other places as well. So again, it's to re-emphasize NHS, the 5 ways of well-being, and looking up on that. Relate have written a few things up around COVID too for healthy relationships. I guess within all of those things, that the key comes again to communicating. So if I were put across to couples now and pregnant would be, it's thinking that there's a little bit of space also put into the day regularly to check across about what difficulties will be coming up. So I'd re-emphasize that again. And I guess perhaps also having mechanisms around conflict management as well. So, naming, if having a process and name around conflict before it comes forwards. And then in the time that you have a sentence or a phrase to say, that, you're recognizing anxiety is coming up, so that you can step back remove yourself from the conflict at the time, but we'll come back to discuss how things might feel difficult on another day. We tend to need about 90 minutes to de-escalate ourselves. So if having conversations in the morning or the evening, when we're hungry, angry, late, tired, all those kinds of factors, a bit more difficult. And I guess on basis of communication, I statements over you statements and non-judgmental phrases, how we word our language, just being mindful of that at this time as well. They're small little tips that may be helpful, but really connecting to others, I guess, can also come in lots of different forms. So for mums to be and for partners, it's also, there's NCT groups are going online. So there are different access kind of points there, and it's still thinking of our social connections, how we obviously do the practical bits of phoning and Skyping and making sure that we keep in contact both with our healthcare teams and with the people that we care about.
Great. So we'll put those resources that you mentioned in the show notes, so anyone that wants to access them can access them there. I normally, towards the end, I give my guest an opportunity to ask me a question if they happen to have one with variable results. But do you happen to have any questions for me?
I guess with your own interest in running this podcast as well, whether I suppose there was anything coming in before having this conversation that felt important for you to think about, and whether there's any kind of lasting question coming up now at the end.
I think it's interesting. So obviously this is a podcast that's primarily oriented around mental health, and that's what our episodes are about. When this started happening, it felt like if you had a channel of information, that all of a sudden it became quite relevant and pertinent to contributing in some way. It felt silly to do a podcast about anything besides this topic. And so we did a very brief episode just explaining literally modes of some information about the virus itself and about the rationale behind social distancing. Then we did, like I mentioned earlier, a couple of mindfulness meditations just to give people some tools to help them deal with it. And then the last episode was this very clear medical perspective from an infectious disease doctor in Scotland. And now, I think there's so much source of information out there. Now I'd like to get back to focusing, as we did on this episode, on how these events interact with our minds, with our mental processes, and not only how to deal with the hardship, which is self-evident, but also what are the hidden opportunities for growth. Because I think behind every psychological problem is an opportunity for growth. And that's why I'm making episodes like this, so that we can try and maximize that opportunity and distribute information that isn't just about surviving, but also about growing past the experiences, growing past the difficult experiences that we have on a regular basis.
That's lovely. I think that's a lovely way to end, Alex, is that it's being human, isn't it? It's trying to have that space, not just of survival, but of flourishing and self-actualization and a bigger kind of focus for us all to kind of grow into ourselves.
Mm-hmm. Well, Dr. Tooley, thank you very much for your time. Stay safe, stay well, and best of luck with your patients and with your pregnancy.
Thanks very much, Alex.
You are listening to the Thinking Mind podcast.
If you enjoyed today's podcast, we'd love it if you share it with a friend, or you could give us a rating on Apple Podcasts, Spotify, or wherever you listen. If you fancy it, you can even buy us a coffee to support the team, and the links for that will be in the show notes. Thanks for listening.